Hi, good afternoon, everyone. It is such an honor and privilege for me to be here with you as we have our discussion and dialogue, and as we journey with you through this conversation on menopause. We want to divulge a little of how menopause impact or affect you emotionally, physically, mentally, or spiritually. And I know menopause has been a taboo in our culture. And I certainly appreciate each one of you wanting to be transparent and sharing your journey and how menopause has impacted your lives. I am sure many of you being married have also have those emotional or deep conversation with your spouse in trying to share your innermost being of how, as you go through these various symptoms and how it impacts, and wanting your spouse to also understand that you are having these feelings, and these feelings are natural and they are normal. So when we look at menopause, we look at a natural decline in our reproductive hormones when a woman reaches her 40s or 50s. And menopause can also be premature. Someone having a surgery called hysterectomy. And so we also appreciate having, I know Mr. Is it David?
Thompson.
I'm sorry, Dennis.
Dennis.
Yes.
Dennis is fine. Thompson is the last name.
Okay. Appreciate having you within our conversation because what it does, it allows you now to give your perspective of how you relate to maybe your sibling, your spouse, as they go through menopause. So your time with us also is very valuable. Finally, also, firstly, I would also just like for each of you to introduce yourselves and just to share with us a little background of who you are and what makes you you. And then we're going to look at the clinical aspect because it is very, very important that we have a great understanding of the clinical aspect and being able to identify the symptoms. On our panel today, we also have Dr. Hilary Brown Adderley, and she's going to share in a little clinical aspect of menopause and the symptoms associated with it. And so before we go forward, I just want to pause a moment and to ask each one of you just to introduce yourselves and give us a little background and a little bit of what makes you you. So I'll pause, allow you to do that at this time.
Good afternoon again, everyone. I am Carol Wallace. I have been married to Anthony Wallace. Come Wednesday, it will be 36 years of marriage. I am living in Jamaica. I am the sister of Patricia Rhodes, the aunt of Lavonna Rhodes, and the friend of Christine Morgan. It's a pleasure to be here. I take it a pleasure to tell you that what you see with Carol is what you get. I am just a simple, ordinary, fun-loving person. Thank you.
Awesome. Appreciate that, Carol. Thanks for sharing. Okay.
I'm Hilary Adderley. I actually live in Atlanta right now, but yesterday marked 15 years since I've been married to Angelo Adderley. We celebrated our anniversary yesterday. I'm a friend of Christine, and I'm sure with the panel, we'll soon become lifelong friends. And it is a pleasure to be on this panel with everybody.
Thanks, Hilary, for sharing. Thank you.
Okay, I'm Marcia Milado Stanley. Being married to my husband, Orte Stanley, for the past 9 years. I live in Mississippi. I worked in the health care facility, and I'm also a Jamaican. I'm also a fun person, and I love my Jamaican food. And That's just about it.
Awesome. Very good.
All right. And so, ladies before gentlemen, I am Dennis Thompson, born and bred in Jamaica. A half of my life, went to London for a little while, then returned to Jamaica. And then from there, we transitioned to the UK. We are now in Florida. Married to Carol Thompson. She's from Upper Trelawney. We've been married for 50 years and known each other for 52. We have 3 children. We have 4 grandchildren. They're all girls. No, yeah, we're all girls. And we have 2 great-grand, all boys, 2 boys. Well, I am an auto mechanic. I work on cars. So I am nowhere near the medical field. However, my wife is a nurse midwife, retired. And so, yeah, we love food. We love Jamaican food. We love food on a whole. My wife loves to tinker with new experiments, new foods and so on. And right now based on what we are hearing, we're trying to see if we can, create a kind of environment where we try to eat as healthy as possible based on what is going on. We're not advocate for the vaccine. And so we are still not vaccinated, and I am very doubtful myself. But maybe we'll have to sooner or later because of the restrictions that probably will be put in place. Travel is what I love to do. And if I cannot travel, I'm lost. So based on what I'm hearing, you have to do certain things before you can travel. And so that is me. I personally am 73 years old. I'm an old man. 73. Still strong. God has been good to me. I give him thanks every day.
Awesome. Thank you so much for sharing. So we have a wealth of knowledge from what I'm hearing with each of the panelists with your total years of marriage. And I'm sure it's going strong still for being together for such a long period of time. And I am Christine Morgan, also mother of 2, and will be a grandmother in November. Excited, can't wait. And so it's a privilege for me to be on this platform also in sharing and allowing you to share your journey and your experience in what it means to go through menopause and the impact that it may have on your relationship. So again, thank you. Welcome. Please be relaxed. Please feel free to share. I will be asking some questions, and I was just going to be asking each one of you as much as possible to be able to share what's on your heart, what's on your mind, and how menopause, because as a taboo, now we need to dismantle some of these thoughts and ideas that's around menopause and help people to identify what it really means when we go through that phase, which I call it a journey. So thank you so much for sharing. So at this point, I'm going to be asking Dr. Hilary Brown Adderley to share the clinical aspect, because as I stated earlier, it's very, very important that we have an understanding of the clinical aspect of menopause and symptoms. And once she's finished with that, then we're going to be jumping right into our questions. So just to ensure that we do have that at this particular time. Thanks, Doc. So welcome again, and please go ahead and share. I just want to also put a disclaimer out there that she's not medically diagnosing. She's just simply providing informational on menopause. Thank you.
Thank you, Christine. Thank you very much. So let's jump in and start by saying what is menopause? Let's look at the definition of menopause. The National Institute of Aging says that menopause is a period when a woman stops having a menstrual period permanently. That's the operative word, permanently. And this period is 12 consecutive months. And there has to be no other causes that has caused this woman to stop having her period for 12 consecutive months, meaning no biological or physiological causes. Because there are causes of women not having their menstruation. That could be excessive exercise, like athletes who exercise a lot, they can stop having their menses and they're not menopausal. Certain illnesses, example, cancer, and certain treatments, for example, chemotherapy, radiation, or even eating disorders. So once we take those out of the picture, it usually starts between the age 45 to 55 in women. Christine already mentioned about the fact that some women do have premature menopause, which is triggered by surgery. And typically that would be hysterectomy with the removal of the ovaries or just surgical removal of the ovaries, which trigger menopause for some women. We do have something called perimenopause, which is not mentioned very frequently. And this is a period that a woman starts to have missed periods or spotty periods. And this starts before the menopausal period. That can start a few years before her actual menopause, where there are less flow of the menses, missed periods, or heavier periods. And the reason for that is because the hormones are beginning to shut down. Just think of like you're driving, and this might be a bad analogy, but it's like you're driving and you're getting ready to stop at a stoplight. And so you put on the brakes and the car is getting ready and it's slowing down and it's jerking back and forth. So this is where the woman will have that issue. I just wanted to show you some pictures of what menopause looks like, and then I will let us go into our discussion. So this picture that you're seeing, remember, a lot of times people say it's in your head. It really is in our head, because if you see this little pink spot right here, this is the pituitary gland, and this is where the hormones, the FH hormones and the LH hormones, that's the luteinizing and the follicular stimulating hormones, those are produced in the pituitary gland right here. And so when it's produced in the pituitary gland, it triggers the ovaries to produce estrogen and hormone, and that's the beginning of our period. When we have menstruation, that happens. When we have menopause, all of this stops. So the brain triggers the pituitary gland again right here to stop producing these hormones, and then they signal to the ovaries to stop producing estrogen and progesterone, and that's where we have menopause. So here's our statistics on menopause. In the United States, about 1.3 million women become menopausal each year. And on average, a woman will start menopause at age 50. Now remember, it can be before or after, but the menopausal average for a woman is age 51. And postmenopausal is a period when women are at high risk for many complications, and the reason is because the estrogen level has stopped. The estrogen is a protective hormone for women, and when we have stopped producing estrogen, you're now at higher risk for cardiovascular disease, hypertension, MI, strokes, and actually you're at a rate of 2 to 3 times more complications than your non-menopausal women who are in the same age range. And then finally, this is a very daunting statistics, but over 60% of divorces are initiated when individuals are in their marriages in their 40s, their 50s, and their 60s. And so that's very important to remember that. What are some of the signs and symptoms of menopause? There are so many. And for brevity, I will just mention some of them. Hot flashes, cold flashes, night sweats, heart palpitations, irritability, mood swings, trouble sleeping, fatigue, anxiety, depression, loss of focus. So some women will have brain fog, as they would call it, poor concentration, urinary incontinence, joint pains, muscle pains, digestive issues, bloating, weight gain, hair loss, tingling in their extremities, and osteoporosis. I'll leave it over to you now, Christine, but that's my presentation.
Thank you so much, so much. So that gives us a great clinical background of, as you're saying, I think, Doctor, you highlighted the fact that we said it's in our head, and it's literally in our head, but we get the clinical picture. The point that also stands out more so to me from your statistics is that 60% of some divorce are initiated because of menopause. And that's why you are here sharing your experiences of what you are going through and how best you can help, either in supporting your spouse or helping people to get a better understanding of what menopause, because that's really what we want to avoid, these divorces, and people to understand truly what you are going through as you go through this natural process of life. So we're going to go ahead with our questions, and I would just going to ask for you to unmute yourselves. I would like for each one of you to share. So I'm going to be asking, and then Dennis, I'm going to be asking a question that's a little different from what I'll be asking the ladies. Is that okay with you?
All right, let's see if we can handle it.
Perfect. So the first question that I would like to ask you, Carol, Marcia, Hillary, if you want to jump in, is that how does menopause affect your relationship? Please share with us, how does it affect your relationship?
All right, I guess I'll go first. I am going to be honest. I think my greatest challenge with this menopause and my relationship is the mood swings that I have. Because I think my husband is trying his best. Because we've had the conversation, we've had the prayers that we pray together. He knows what to expect, but I think the mood swing can throw him overboard because sometimes I just can't control it. And therefore, I think I am the problem in the relationship with the menopause, not my husband.
Okay, that's a great perspective of looking at it. So you believe as you go through this natural process that you are the problem? Is that what you're saying?
Yes, I am.
Is that something that you can help or avoid?
Sometimes, because you do catch up on yourselves and say, hey, was it the person you were just asking where he is and now that he's home, you just change like a lizard? You know, so I keep asking myself, girl, when are you gonna do better than this? Don't you see the man is trying to live with something that he doesn't really know about himself? Give the man a break. But I really try at times, but sometimes the mind doesn't say try at all.
Okay. And so you're saying that those are some of the things that you will do. You talk to yourself to help you go through that journey of where you are with the mood swing. Is that what you're saying?
I just get irritable over nothing, miserable over nothing. He seemed to be nice, and it's as if I can't accept being nice too. And then it's like a thermostat, like a refrigerator. It gets cold and in a second it's hot. That's my feeling.
Okay. Well, thank you for sharing that. You know, as you're saying, you know, that's something that you as a person has to try to go through and to deal with in how you adjust with your spouse in relationship, in your conversation and your mood swings. That's one of the great symptoms of menopause, that mood swing. So thank you for highlighting that piece. Great. Okay. All right, Marcia, I'm going to be asking you next the same question. How does that menopause, whatever symptom you may be experiencing, how it affects your relationship?
as the other lady, first lady has said, I think the mood swing is the worst one of all. Apart from the hot flashes and the everything else that goes with it, but the mood swing really gets you all the time because sometimes it's like she said, where are you? Are you gonna be home in a minute? Yes, but as soon as he comes in, you want to be alone. You don't need company. You just want to stay by yourself and to be locked up in your own space. Um, for me, I mean, my mood swing is really, really, really bad. If he'll be on the bed with me, shaking the bed, ooh, I get so mad. During the winter time, that's the worst time either, also, because I'm always hot. Hot, 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 hot. In the winter, I got to turn the fans on. I had to close the vents to my room so that I don't get no heat in there, no heat in there. Because if the heat comes on, I hit the roof because I would be so hot. I remember once when I just started going through the phases of menopause, I thought I was pregnant. And boy, everybody was flabbergasted. Everybody wanted a baby. I wanted one. He wanted one. And man, when I realized that when I did all the tests and everything and there was no baby, we were so devastated. Only
Wow.
to know that I was going through menopause. I was going through the first stages of menopause, and that really, really had us because I really wanted one. The other thing that really affected me um, is like a low self-esteem. You feel less attractive. You don't feel, you start wearing baggy clothes. You're not the same person that you used to be. The things that you were also interested in earlier on, you don't want to be bothered no more. You just want to do maybe lay down in your room all by yourself. And that really can drive him up the wall because he's a loving person and he always wants to be around me. But shaking the bed is a problem. Slamming the door is a problem. Just being there is a problem. And
Yeah.
how can I tone it down a bit? I don't know.
So in all of that, and thanks for that insight, Marcia, in all of that, how do you usually try as you go through that journey? How do you try to relate with your husband at that particular time? What are some of the skills or things that tools you may use to help you as you're shaking the bed or he's slamming the door, he wants to touch you, or what are some of the tools that you usually use to help you to navigate that particular time?
Slamming the doors, I would say, Artez, you can just pull it up. Don't slam it. He said, did I slam it? I said, yes, you did. And shaking the bed, I would say to him, man, are you okay? You sure you're fine? Shaking the bed made me feel so uncomfortable. Could you mind not shaking the bed so much? And he's always the type of person that will say, well, okay, I just don't feel comfortable this way and I got to move. I said, man, you got to go to your room now. Because you're really getting to me. So some of the time you understand sometimes and sometimes you don't.
Yeah, yeah. And from what I'm hearing you say too, is that if I'm hearing you correctly, is that you utilize the word, your I word. This is what you're sharing your feeling.
Yeah.
That would also help to go through it. Yeah, that's very good. Very good. Good insight there. Thank you. Thank you. Yeah, so Dennis, you've just heard, and I'm sure you experienced with your wife as she goes through, because some people, their menopause may be different. The symptoms that they experience may be very, very different. How do you relate to your spouse when she is going through the various symptoms of menopause? What are some of the things that you do to provide that support or help for her as she goes through that?
Thanks for the invite again. Truth of the matter is that for me, it was it was difficult because I didn't understand what was happening. You know, my wife, prior to her current job, let's say the one that she retired from, the job before that was taking her some hour and a half driving time one way. So she would drive to work hour and a half and she would drive back in the evening. Everything seemed to be fine for a whole year or close to a year. She did that. She got a job closer home, which was less than a half an hour driving time. And then all of a sudden, she started saying that she cannot drive home. She's like literally afraid to drive home. I said, afraid of what? You know, she used to work what we call graveyard, or what you guys call graveyard, late night from 11 to 7 or something like that. And because of the nature of her job, sometimes she's on call. When she's on call as a midwife, she will have to leave. The woman started to give birth at 2 o'clock in the morning, or somebody came in early morning, and so she's up. They call her, she's up, and she's gone. But then sometimes she said, I'm afraid I can't go, I can't drive. And I'm thinking, what do you mean you can't drive? You used to drive hour and a half one way. What do you mean? And it was hard for me to grapple with what was happening. I don't think she even understood what was happening herself at that first stage. And so I would have to get up and have to drive her to work and then probably just wait for her a little bit and come back, you know. So for me, it was kind of troublesome. Not boring, it was troublesome. I just feel, I love my sleep. And when my sleep is being disturbed like that, I get very miserable. So, you know, I am doing it, but I'm not doing it willingly. And so I can understand clearly when they said marriages will break up as a result of menopause. I can understand that very well. It wasn't hard. And again, my sister said she didn't want her husband to touch her. There was time when Carl don't want me to touch her. Just leave her. And I couldn't understand, you know, this is time that we should have some companionship going. And what do you mean, just you're not in for it kind of thing. And so for me, that was again hard. And so let me tell you the truth. A lot of time the thought come, man, I probably need to go find a woman somewhere. You know, but the truth is, we've been together, and I made a promise with my wife before we even got married. I said, listen to me. For me, marriage is not just getting in it, and when things go wrong, you walk away from it. No, 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 no. If we are in it, we are in it, and we're in it for the long haul, till death us do part. Do you understand that? She said, yes. And if you go to Timbuktu, I'm coming with you. If you go to the hills of Gilboa, I'm going with you. I said, fine, that's good. So we got married. So when the trouble starts, I couldn't understand it, but I remember my promise. I said, I will not leave you. No matter what, I'm gonna stick with you. And so, you know, I bear it. And we went through. My wife will tell you that I was not supportive because I wasn't understanding what was truly going on, you know, until maybe one or two friends would come pull me to the side after maybe she complained or something. And they would say, listen, man, be patient, because what is going on, you don't understand. I don't know if you will truly understand. So just bear it. It's gonna pass. It too shall pass. And so with those little encouraging words from friends and so on, I hang in there. I hang in there. And today, we literally have gone past it. I don't know if I can say it here, but you know, that has left her with two things. One, she still goes through anxiety from time to time. Two, she has high blood pressure. These came along with her menopause as she goes through it. And so she lives on some medication today. Literally, she will, when we're going out, she will make sure she has this, that, and that, because at any time, something can crop up and she will get probably anxious or so on, you know? So that is my take on it. Yes, it's not an easy thing from what I'm hearing and from what I've experienced. It is a traumatic experience for some men. And I can understand why some men actually walk away because of lack of understanding.
Wow, wow. I love the idea, the thought, and I appreciate Pat having a male within our team, because you have just said something that I'm sure right now, whomever may be hearing this video will truly understand the impact that menopause can have on marriages. And then from the male perspective, being able to see how best you can be supportive. And not necessarily, it's not the end, as you're saying, because it will pass. And you were able to journey through all of that with your spouse. And now at this particular point, have a better understanding. Both of you have a better understanding. So as I share with those who are maybe listening, to know that it will pass. And it's important to have a full understanding of what your symptoms are, what you're experiencing, and being open and sharing with your partners or friends exactly what you're going through. I do want to interject. I remember working in the corporate world, and I used to be very embarrassed when I'm sitting amongst a table of all men, and I'm just sweating and it's just running down. I'm in a business meeting, and people are, men are there, and I'm feeling, I'm hot, I'm fanning. And it took me a while for me to be able to adjust to the fact that that's my norm. That's where I am at this moment. But it took me a while. So I do really appreciate, the information, the insights that all of you are providing as you share how it impacts your relationship. I'm going to jump over to Hillary if you want to share also your experience.
So a couple of my friends have talked about brain fog, which I can actually relate to, where there's this sense of not remembering words, trying to find a word, searching for a word, loss of concentration, which can be very, very difficult, especially like Christine says, in business meeting or professional meetings or professional presentations. And so that can be a big, big problem. And a lot of times women don't realize that. They may reach a point in their lives where they suddenly can't remember things or suddenly can't remember words, and they're like, oh, it's just old age. It actually could possibly be a part of menopause, and women need to remember that that can actually happen. 45% of women experience all that we just discussed. It's called psychogenic, where we have the anger sometimes, irritability, anxiety, tension, and so on. Loss of confidence. Marcia talked about loss of confidence. And I think I'm so glad that Dennis is here, that men need to hear this. When women have gained weight, and like she said, she was wearing baggy clothes, their body image has changed, and we really need the men to remember that this beautiful, gorgeous woman you met at maybe 20 doesn't feel the same way at 45 or 48. And they need to remember that it is important for the woman to be told, you're gorgeous, we love you, you're beautiful, so that's just what I would say.
Awesome. Very good. Great dialogue. I am enjoying it, and I hope you all are. At this point, we are going to pause for a break. So I just want for you, stay tuned as we rejoin in a couple of minutes. Thank you so much.
This is your prayer coordinator, Ella E. Brady, coming from Coconut Grove SDA Prayer Line and Worship Service. If you need prayer for anything, just give us a call. We'll pray with you and for you. Prayer is the key that opens heaven's storehouse. Call Elder Brady anytime at 305-252-2614 or online at 313-209-8800. Code 987-6511 between 7 and 8 a.m. God bless.
Okay, welcome back. We've been having such great conversation with Carol, Dennis, Marcia, and Hillary in regards to menopause. We have gotten some great insight of how it affects relationship. And we also appreciate Dennis's perspective because even though he may not necessarily be going through that physical stage of menopause, but he has been experiencing it through his wife. So we appreciate all the insights provided thus far, and we have learned that it does affect relationship. And so we just have to be able to be educated of how best, as we have that communication with our spouse or family members in regards to what we are going through and how best for us to be able to address that situation. So thank you so much for that. So the next follow-up that we want to look at is what would you want for men in particular to know about menopause? What are some of the things that you would like to share that a man listening or male listening or other family members or friends listening will be able to get a great understanding of what it is that they need to know about menopause? And I will start with Marcia.
Menopause is that it's a life transition that can affect you physically and emotionally. And your body's experience fluctuating hormones that can cause hot flashes, night sweat, itchy skin, headache, mood swings, and irregular period for those in the first when you're just starting to go through the menopause. But also it's not something that you need to run away from. Instead of trying to understand what is happening to her, how can I help her? Is there something I can do? And the most questions and the most things that men did, they went out and get you things. For my husband, he went out and he bought me ambulance. And that was a big no-no because I did not want another pill. I've been taking other medications and I did not want to take another pill. So that was a big turn off for me. For him to bring me something to help me, he was trying to help me to overcome what I was going through. And that was wrong. I didn't want another pill. And that made things really bad. I think I dealt with it in the wrong way because instead of telling him, no, I did not want another pill to take. Just let me be, let me cool down a little bit, let me be, you know, he was trying to help. And I had to apologize to him because he was definitely trying to help. But the urges and this mood swing and the everything else was too much to handle.
Okay. So what you're saying, it's good that if you want to share to the men, just let them know that you would prefer that you tell what exactly that you would like versus them just going out and taking the initiative to do things. Is that what you're saying?
Yes.
Okay. Perfect. Awesome.
I could jump in, Christine. I really want to be back on Marcia. We do know men have the tendency to want to fix things. They're solvers, problem solvers. And so definitely what Marcia is saying is that men, they're seeing their wives suffering and they want to fix things. But this might be one of the times when you have to probably just sit back and ask her, how can I help you? What do you want me to do to make this better for you? Because they can't fix what is a natural process. So just ask, how may I help you? If she's having a panic attack or a mood swing, maybe you just don't want to respond to her anger, just stay out of her way. Just ask her, how can I help? Another thing I would want men to know is that, the intimacy in the marriage might change. And this is not because a woman is lazy or just don't want to be with you. It's not about the man where he thinks she doesn't love him anymore. He needs to understand that this is physical. The woman has vaginal dryness. She doesn't have the vaginal secretions she used to have. And some women may have painful intercourse. And so we have to make that clear that she's not trying to maybe spite her husband or not trying to say, I don't love him anymore, but it's just actually a part of the whole process of menopause.
Awesome, awesome. I love that. Thank you so much, Hillary, for that follow-up. That is so important, which is, as I said, one of the major, I think Dennis alluded to the fact that, he felt sometimes he felt at a particular time would just want to walk and leave and have someone else. So that's such a great point you have brought up. Thank you for sharing that. Great. Okay, Carol.
All right. Well, I have not perfected it yet, but I would love to say to the men out there, what is happening to us is nothing that we beg of ourselves. And the changes that we go through, we have no control over them. We can control our behavior and how we react. But as to the changes, we have no control over them. And I would love to say to us as ladies too, I have tried something and it works. So I would love to tell the ladies out there who are having the vaginal dryness, take the initiative, get your moisturizers, surprise them, because I realize that it's not all the time you're not in the mood. Sometimes you're in the mood. And another thing before I get there, I remember praying with my husband, and he actually laughed in the middle of the prayers when I prayed him. I said, God, when I reach the menopausal state, please don't let me drive my husband away. I would rather if you make me be someone who is running down sex than to run away from it. And I don't know how much the Lord has answered, but I think he's answered me if it's even halfway. So I take the initiative. The only thing though is that you don't have the feeling regular. But men, come on, take the initiative, read the signs. We may not have the feeling, but make a start and you will be surprised to know how much help you get there and how it turned out to be. So I'm just saying, let's open our minds to what is happening. This is our life. This is how it's going to be. Accept it, run with it, and do the best we can.
Awesome, awesome. I love that. And you just provided some tools, Carol, in ways how to deal with that. And as you're looking at it, not just from the man's perspective, but you're also sharing with ladies some of the things that they can do to help to create that intimacy and that bond, even during that difficult time. Great. Okay, Dennis, I know as we're talking about from your perspective as a male, what would you want to share with another man, another male, of what it is that you would like for them to know in regards to menopause in women?
A lot of it's been said already, but I am saying, I would like the men to know that, listen, man, if you love your wife, if you truly love your wife, then don't run away from her. Don't leave her. The time she needs you most is probably seemingly the time that she wants to push you away most. But the truth is, my wife would say to me, if I behave in any way, just hold me, just hug me, just hold me tight and don't push me away. Yeah. And so that is something I'd like to say. Even if they feel like they don't want you to touch them, just grab them and hold them tight and hold them and just tell them you love them. I love you, baby. I'm good. It's going to be all right, kind of thing. And so, yes, but this is a very interesting discussion. This is a time when, I think a lot of men should be listening in on this, because the truth is, until we understand what is happening, we're going to want to do other things or make other decisions that will not be good for the relationship. So, I will say to the men, be patient, be loving, and be gentle to your woman, to your wife, to your spouse, because sooner or later, maybe the shoe will be on the other foot, where you as an old man, an older man, might not be in the position to do what you used to do. And so as a result of that, now your wife is probably the one to say, you better, I want somebody now, but you're not able to. So the truth is, we need to work together as couples, work together and be sure that you age gracefully together until the time comes when one of us will have to go.
Awesome, great wisdom coming from the male perspective. Thank you, Dennis, for sharing that. And so overall, as you all look at the menopause journey, what are some of the things that you think that some of the triggers that you see that may cause some of the symptoms? I know typically I've shared and I've studied and I've even with my own journey that I have to be particular with my diet. I have to make sure that, you know, I know the carbs are one of those driving force that pushes me into hot flashes. So what are some of the triggers that you see that whatever the symptoms that you may experience, and how best do you help to go through those feelings, as especially when you go through those hot flashes and those mood swings, or I think you've highlighted some of the intimacy that you do, the things you could do with the intimacy, but what are some of the triggers that you see sometimes that may be impacting or aggravating the symptoms more?
I would say, I'll add on to yours, Christine, diet. Diet is a big thing in triggering hot flashes, cold flashes, and not sleeping well. And you did mention carbs. That's a big thing. For us as Adventist women, the great thing is we don't drink caffeine, but caffeine is another one. Sugars, sodas, and different women have different triggers. So women need to look, maybe get a diary or what they need to do and see when they eat a particular thing, they have more hot flashes. Some women are soy. So look to see, what are those triggers? Another trigger is stress. And who doesn't live in a stressful world? But stress is a big trigger for worsening the symptoms in menopause. And so women we are always givers and nurturers, have to find a way to stop and look after ourselves. Self-care is very important. I saw a sign the other day that says, stress, I need to break up with you. So I want us as women to think about that. We have to decrease our stress. A lot of times we're afraid to say no, especially to church activities. But if we think we need to do self-care and step back a little bit from church activities to take care of ourselves so that we can be there for our husbands, we need to do that.
Awesome. Thank you. Great triggers. All right, Miss Carol. What are some of the triggers that you may identify in your regards to some of the symptoms, and how best can you help to facilitate the person who may be your spouse in helping you as you go through those various symptoms?
I may not have a lot of triggers because I really don't have a lot of the symptoms that are in the menopausal. I'm giving thanks to God. But what I can say now is, if I knew then what I know now, and I would love to say to the men out there and even us as women, knowledge is everything. Because I listened to Doctor a while ago, and she hit everything on target. But Doc, you know that because you have been through it and you see us and what we go through. So I'll encourage us to read. Men, read. Because I have taken sugar out of my diet. nothing with added sugar. I don't say I don't have sugar because it's in the juices, but I try not to add, I don't add sugar any at all. And it makes me feel great. I have dropped dairy and I'm trying to drop a lot of things, but then I'm not saying it's too late, but I think if we knew then or pay attention more then, it would have been so much better for us. I wear loose, light clothing. I may have the flip end of feeling down. I get this, and maybe Doc can say I get this elevated feeling of my elevated self-esteem. Honestly, I just feel great. I like to do me, and liking to do me, men, please support us. We like to do us at times, especially in this stage. Help us to lift our self-esteem. What we're going through is enough for the brain, so at least help us along the way. And I would love, Sister Christine, I know you have your questions, but I would love for Doctor to touch on postmenopausal spotting, because that was where I started learning everything. Because in my days, Doc, I thought when I was seeing a period and feel pain, I think that was normal and okay. I have learned now that it's not okay. That is a sign that would have been showing us that come this age, something was going to be wrong.
Great. Okay. Hillary, would you like to? Okay.
Okay, I can touch on that. So like we said, the menopause lasts for 12 months. I mean, the no period, you know you're menopausal. The menopausal years can be from 5 years up to 14 years. So it does end. It just, you know, we just don't know. Everybody, it's individual. And Carol, you hit the nail on the head. Any postmenopausal woman who has any kind of spotting or bleeding needs to seek medical attention right away. It's not normal. It's not normal. They need to get medical help right away. So we'll use this format, if it's okay with you, Christine, to let women who are menopausal, you've been menopausal for 5 years, 10 years, if you see any kind of spotting, you need to go and get medical attention right away. So thanks a lot for bringing that up, Carol. Very important point.
Right. Yes. And as you said, this is informational. Definitely, you know, as you do go through, have those conversations with your doctor. Things are different. I'm having palpitation because, as you're saying, many times not having the information, not knowing. And I hope this video will be able to help at least one person, a male or female, being able to get a better grasp of truly what menopause is. It could be someone who may be planning to get married now and knowing that in 15 years or 30 years, your spouse will be experiencing these. So you're prepared for that journey that's ahead. A great conversation, and I do like that. Dennis, as we're coming on to a close, I just want for you to, you know, to share. I know you, with your wife, you have seen the various triggers. What are some of the things that you did to help her as she experienced whatever trigger that may come, that may start or exacerbate the symptoms? What are some of the things that, from your male perspective, that you would tell to another male what you can do to help to alleviate some of those triggers?
We just talk about education being absolutely important, because I did not understand what was happening. I was of little help to my wife, very little help. In fact, I thought at one point she was putting this on, right? She was putting it on, and she was trying to do things to get me involved. But I didn't understand then. And so for me, I would suggest, and you know, all of us on the platform here, we probably are there or going past it. I would suggest, and this is my recommendation, that this thing being so, to me, very important now, that we educate, get a few young people, male, female, young boys, young men, young couples, put it that way, couples who have not yet gone through that, bring them on, educate them, and so they in turn can pass it on. Yeah, bring the older people who have gone through it and who are going through it, so that this thing can catch, you know, the young people can catch on, and when their turn come, because it will come, it's a natural thing, it will come if you live long enough. And so when the women are going through it and the couples are involved, then you know, the men can better able to support the wives, support their spouses in this thing, because trust me, it can be very traumatic. And as the doc says earlier, many marriages break down because of what happened. And like the lady says, it's nothing that she has done, nothing that she can control. It's out of her control. This is a natural cycle in life. The rhythm of life continues. And so I am saying that from my angle, I was not very supportive of my wife because I did not understand what was happening. It's a shame, but I'm telling you the truth. I just speak what the truth as it comes. You know, now, you know, life has some twists, you know, and maybe that's what God is saying. We need to make right choices, right decision at the beginning. And so because life goes on once, we don't have no second chance in this situation. Women go through menopause once, not going through it twice. So you don't have a second chance to catch up or to make good where you went bad the first time. So bring in some young people, I would recommend, and this is an excellent discussion. Bring some young people in, some people who are involved, doctor, yes, midwives, people who have been there, husbands and wives who have experienced this, bring them in. And so again, this is a beautiful discussion. And I would encourage that this thing this is not the end of it, but the same organizer come back with a new format and bring it to light.
Awesome. Very good. Great. We certainly, that is the goal for education, and to let individuals know that they're not alone. You're not isolated. It's a natural process, and it's how we deal with the situation, how we have our support system. And to add, just as we're going to be closing here, is that sometimes not just our spouse, but sometimes our siblings or friends or co-workers also need to identify. I just share quickly, I remember talking to my eldest brother about it, and you know, what I was experiencing, and he started to share with me what he was experiencing from his wife perspective, and how he was able to deal with it. I'm like, oh wow, that they mean they're men who certainly understand and are willing to support their spouse through it. So it is not just as our spouse, but also our siblings or co-workers or other individuals who also need to have an understanding of what it is and how best we can support each other through these journeys, because some people are embarrassed of even saying what they're going through. And
Right.
So education is such an important thing. You're not alone. You're not alone. So as we close, I just want from each one of you just to give one sentence of what it is you would like for someone else to know about the impact that menopause have on your individual lives. Just one sentence you would like to share with someone, what impact that menopause have on their lives, and what they would need to know.
Christine, can I just jump in real quickly? I really wanna salute Dennis. I know that it is difficult for you to admit that, you know, you weren't supportive, and we really appreciate you being so candid and so transparent. I bet a lot more men can relate to that, and the fact that you stepped up and mentioned that will help a lot more other men. So I really want to thank you, Dennis.
Great. Yes, yes, definitely. Thank you for highlighting that. Yes, yes. Okay. While you're there, Hillary, talking, is there one thing you'd like to share with your audience about menopause?
I just want to tell a lot of women out there who have been second guessing themselves, doubting themselves, may have had spouses who have put them down and made them feel even less confident, that they're not alone. It is a reality. It is a natural process in life. And if they need to seek medical attention, medical help, they should go ahead and do so, because it will not last forever. It will pass, but they should get help, especially if they're anxious and depressed, to get medical help so that they can go through this.
Thank you. Thank you. Marcia, what one thing you would like to
And
share?
another thing that I'd like to share is to get group help. You know, form yourselves in group of your age, or maybe people that will understand what is going on with you. Talk about it. Don't lock it in. Just don't keep it to yourself as if there's something secretive. You know, share it with, or share your views with other people so that you can get better understanding of what is happening to you and how best you can deal with the situation, because lack of communication is, you ain't gonna know nothing. So as Dennis had said, read up on it. um you know, just talk about your own experiences, because when I started first, I know nothing about it. I wasn't even aware of, I know about the symptom of menopause, but to actually feel the effect of it is like feeling it is so different from knowing about it. You didn't know what to expect, if I'm making any sense. When the things start happening to you, you weren't aware of what is happening. Or is this the time? Is this menopause time? Or what have you? Because as I said, I thought I was pregnant. And I went to go do pregnancy test and everything, only to find out I wasn't pregnant. So there is a lot of things that you can talk to, get together with in a group, maybe at church or at work or wherever, and just talk about things that you're experiencing that is happening to you. And you know, somebody will come up with an idea to say, maybe this is what's happening. Maybe go to the doctor then and find out what is happening.
Thank you. Thank you. Carol?
I just like to say to those of you out there who are listening, menopause is not the end of the world. Just embrace it as your new life. Go for it. Do the best you can. Embrace it because it's not going anywhere. Seek help if you have to, and trust in God. Thank you.
Thank you so much. And Dennis?
For me, again, education. I think we come on the bandwagon. It's like after the horse bolt, we're closing the gate. We need to deal with the situation before the horse goes through the gate. And hence we need to bring young couples in here, and with the doctor's advice and suggestion, so they are aware of what is to be. I don't know what is wrong with us, why we don't want to talk about some things, but I think we need to talk about some things. Some things must or should be spoken of so that we are aware before it actually happens upon us. You know, it happens to us or with us, especially the women and the men too. So for me, this is an eye-opener. You know, at least the experience with my wife, what we went through, it's an eye-opener for me. And I always want to say, if we could have done this again, if we could have gone through it or go through this again, it would have been wholly different as far as my relationship with my wife is concerned. So education, absolutely, yes.
Awesome. Awesome. Wow. What a great experience as we journey together on this topic of menopause. It is such great insight, your knowledge, your expertise, and being transparent, being candid, putting yourselves out there, realizing that this is a part of life. And as David says, we are fearfully and wonderfully made. And so we accept all these various transitions in our journey of life, and knowing that God promises that he will carry us through. So again, I truly want to say thank you so much. You have shed such great light and insight on the topic of menopause. And I'm sure that many who may listen or who may watch may also get an insight of what it is and that they're not alone, and that education is so important, and that when you're going through these, feel free to share. Don't need to be embarrassed about the situation because it's a natural part. And as as our panelists I highlighted, this too will pass. So again, it's such a pleasure, Hillary, Marcia, Carol, Dennis, having this conversation as we journey through menopause. Thank you so much. We appreciate it, and you have a great day.